thank you all for joining this session and this debate that we have set up for today. Thank you to all the panelists, associations, patients, experts, and politicians who have got involved. And I have a very special thank you for my team, Maria, Leticia, the technicians, because they have made this meeting possible. We have prepared it with lots of care. It's an act of love, and I think you can tell. Why? Why is this an act of love? Because you deserve it. As patients, you deserve to be listened to, and you deserve that politicians get involved with your issues. We should get involved with patients and with ME. The aim of this event is to take stock of this past year since this resolution was adopted a year ago. I think this is a very important resolution. The European Parliament asked the European Commission for additional funding for myalgic encephalomyelitis research. There are over 2 million Europeans who have this condition. It affects young people, adults, and the elderly as well. Between 80 and 85% of all patients are women. This condition has been subject to not only suffering and pain, but also stigma, prejudice.
Era imprescindible que fuerais escuchados.
This is why it was so essential for us to listen to you and give you hope. This condition is particularly harsh. I don't need to explain that to you. You all know it, while we can only imagine it. In this space for debate, we want to continue the work of the European Parliament, and we hope that this project will be constructive and useful, especially useful. We need to work together in order to make the most of the opportunities provided by the Horizon 2020 in order to get additional resources for diagnosis, research, treatment, and cure of this condition. That's the final goal, of course, to find a cure for this condition. Find the right treatment for our patients and enable faster diagnosis. This is why patients, researchers, and politicians have to come together and do our best. Patients are already doing their best. So are researchers, but politicians need to start doing it. The lives of millions of European citizens are at stake. Now that we have suffered from the COVID-19 pandemic, we have seen that ME is closely connected to viral conditions. We need to make the most of the sad situation of the pandemic and the unfortunate consequences thereof. We need to study the direct relationship between this situation and your condition. There is a fantastic window of opportunity for research, for us to work together to achieve our goals, our shared goals. I got to know this condition because of a person who I think is here with us in the room, Aina Opi. I met her in Barcelona. I remember what a big effort it was for this person to come and meet me for a cup of coffee and tell me about this condition. I invited her to the parliament so she would get to know it, but this hasn't happened yet, unfortunately, because of the pandemic. However, my commitment is still strong. I am committed to patients and associations, and I want to reach this goal and make the most of this window of opportunity. We need coordination, cooperation, and working together. We need to work in research to find treatments and cures for this condition. We need to invest our resources so that pain and suffering become no more than a bad memory. So thank you all again for coming here. Welcome to our panelists who are the protagonists of this session, and I hope this event will be interesting and useful and will shed some light into this over the situation of research of ME in Europe and bring this closer to our shared objective, which is finding a cure. Thank you very much, Jordi. I think you have spoken very clearly and provided a very good overview of the objectives that all panelists here share. We have representatives from many different groups. Without further ado, let's start with
a trasladar la voz de los
which
pacientes
is about giving patients a voice. We will have two members of MEC with us. MEC is an association of patients and carers that was set up in Holland in 2008. To start with, we will watch a video that Evelyn van den Brink recorded. She is the co-founder of MEC, and she was the author of the petition we sent to the European Parliament. Her role was essential to get this resolution adopted in 2020. So whenever our technicians are ready, we are ready to watch the video.
Honorable members, I warmly thank you for your incredible work on the resolution for myalgic encephalomyelitis and your support for this important cause. As politicians, you have an important role to play. I see science as a bright beam of light. You are the mirror that can amplify and direct this light to reflect it right into our lives. The progress that has been initiated in Europe is giving ME patients hope. In our everyday lives, though, nothing has changed yet. There is still no diagnostic test or treatment. The hidden cruelty of this disease is that ME patients continue to live isolated lives even after lockdown ends. We understand that change takes time, but for us the clock is ticking. Anyone can get an infection. Anyone can go on to develop ME. Young, sportive, strong, and intelligent people who are full of life can be taken down without warning. Suddenly, life as you knew it is over. ME patients and their families long for light in their lives. It is my greatest wish that all patients can count on your continued support and commitment. You can give scientists the full opportunity to solve this disease as soon as possible. Science is the only way forward. Thank you very much.
Totalmente de acuerdo con todo lo
I
transmitido.
fully agree with everything Evelyn said. Thank you very much for your hard work, and thank you for sending us this video, because we know that Evelyn has very severe ME. Now that we have watched this video, we have a patient representative, Alice Frakia. She is also a member and representative of EMEC. Alice, you have the floor. Your microphone is muted, so if you could please activate it. Thank you very much.
I don't have anything to add. I am not myself a patient, but I am a mother of a young patient, of course. I must say that we are really hopeful now. And we are hopeful as an association, as patients, as carers, because of the incredible support that we've got from the European Parliament. I remember going to this petty commission, and then I understood that this was going to last, that this was not going to be something that is forgotten the day after. And I think that Jordi Cañas is a perfect demonstration of how much this Parliament, European Parliament, which a Parliament that really understands what citizens, even I would say the ones that are invisible, really need and long. So thank you very much. Thank you for the Petty. Thank you for the Petty Committee. Thank you for the Parliament for the resolution. It was really a light in a very dark moment for particularly for some of our patients. Thanks to this resolution, of course, we felt really encouraged, and this foundation, MEC, European ME Coalition, sent also an open letter for scientists in order to say, let's move ahead. As Evelyn said, the real hope is with science. But what happens with illnesses, diseases like the ME or others, because it's not the only one, which bears a terrible burden for the patients, be them children or adults, young people, of course, mainly women, but not only women. What is the situation is that there was no hope. But now we know that the only way is to have researchers with a long-term commitment for funding in order to find what we need. What do we need? We need, as Jordi Cañas said, we need diagnosis. We need biomarkers or diagnostic means. Why? Because if you don't have that, it's very difficult to get diagnosed. And many of our colleagues, many of our carers, many of our patients say it took years and years before they were diagnosed. So we need a diagnosis. But it has to be biomedical, because we need also to make sure that the medical profession do understand this illness. Because as Jordi Cañas says, it's also stigma around this illness. How many times people who were really suffering for years were said, oh, you know, this is because you really do not exercise enough, or you really do not want to get better, or maybe because you are weak or because you are depressed. So this, we do not want to hear it any longer. And for that, what do we ask? We ask to have a diagnosis so that medical doctors, the medical professions will understand as quickly as possible what kind of illness the patient is suffering from. What we also need is, of course, to be able to make people understand, and particularly, as I said, medical doctors, medical profession, understand this illness. And for this, we would like to have, and we hope that we will have, what is the European reference networks. We do not have a European reference network for this illness, and we do need it, because we do need that around Europe we have good practices that are really in a kind of a structured way understood, and they are disseminated. Of course, we need biobanks. We need to have biobanks and a number of people who can
Alice,
become.
tenemos
Yes?
vamos con el tiempo súper justito, por favor.
Alice, I'm sorry, we don't have that much time.
No sé que los pacientes
So
tienen mucho que
if
decir,
you can,
pero,
please conclude soon. I know that patients have a lot to say, but we don't have that much time.
What I mean is that what is we are asking is very clear. We need long-term research, not only one fund. We need diagnosis, and we need to have the possibility to disseminate good practices. We really hope that this is going to be possible in the Horizon Europe program. And for this, we need a particular mention for these illnesses, because they are under research, because there is no money. So there are very few people who can engage into this research if there is no money, if there is no possibility of publications and visibility. So this is what we ask. We are very hopeful because of this continuous support, strong support, solid support from the European Parliament. And we know that we can really trust you. Thank you very much.
Muchas gracias, Alice. Has trasladado perfectamente en tu intervención toda la visión global de los pacientes, desde, como decías, desde los niños, que son los que tienen un mayor problema porque empiezan mucho antes con esta enfermedad, hasta
until
adultos y
even
sobre todo el gran
adults,
estigma que tenemos las mujeres.
and the great stigma we have.
Con el evento, la siguiente sección.
We continue in the next session
Investigación.
is that of research,
Investigación, estado actual, retos y
state
relación
of
con el
play, current challenges, and deal with COVID-19. This session is dedicated to investigators. In the first place, we will have a representative from Euromin, whose main goal has been that of creating an integrated sustainable network of researchers in Europe working on myalgic encephalomyelitis. Dr. Eliana Lacerda will speak, who is clinical assistant professor and part of the QME team at the London School of Hygiene and Tropical Medicine.
Le cedo la palabra
I leave the floor to Dr. Lacerda.
Thank you very much. Firstly, I would like to thank you, all the organizers, to have the opportunity of the European Network on Myalgic Encephalomyelitis Chronic Fatigue Syndrome, or EUROMIN for short, to be into this debate. I probably will be repeating some of my previous fellow persons in relation to some data. So as MP Cañas said, we have around 2 million people living with MECFS in the European Union. The annual burden of this disease may represent a cost to the EU of around 40 billion euros, and a reduction of only 10% from this burden would save about 4 billion a year. Most people with ME do not have access to health services that are able to provide diagnosis and clinical management for this disease. Many remain undiagnosed or are underdiagnosed or misdiagnosed, and stop working or studying due to their symptoms, with consequent social isolation, financial hardship, and stigma. The EUROMIN assessment on MECFS diagnosis and health service provision confirmed that the health needs of people with MECFS are still largely unmet in Europe. The existing specialist services are scattered within only a few EU countries and are restricted to specific geographic areas. This results in limited access to services, causing delays to diagnosis and consequent health decline. Also, intersectoral policies for MECFS are virtually inexistent in the EU countries. Integrated policies involving work and pensions and the education sectors, for example, could provide significant support to those affected. EUROMIN researchers have been also interested in long COVID. A substantial proportion of people recovering from COVID-19 develop symptoms that largely overlap with those of MECFS, suggesting that similar disease mechanisms operate in both conditions, particularly considering that the most cases of MECFS are triggered by infections. This current situation provides us an opportunity to understand why some people develop such disabling symptoms following an infection, and why some develop MECFS and others don't. This could also lead to the discovery of biomarkers and specific treatments which are currently not available. Therefore, clear policies and funding for advancing the research field at a European level are urgently needed. The EUROMIN also found that biomedical research in this field is still scarce if compared with other complex chronic diseases. This is partially related to the very limited funds available for research in MECFS in Europe. Internationally, most of the funding opportunities comes from the US National Institutes of Health, NIH, with an annual budget of $14 million for MECFS only. Yet, despite the MECFS being more common than multiple sclerosis, for example, the latter has received 5 times more NIH funding than the former in the last decade only. Europe needs at least the same level of funding that is available in the US. Research investment in other complex chronic diseases have led to great progress on diagnostics, therapeutics, and improvements on the quality of life of those affected. This still needs to happen for MECFS, and the time is now. As we showed in the Euromin published reports, the societal costs are too high to be ignored. The MECFS charities have been helping enormously by funding pilot studies, but meaningful progress will need sustained availability of core funds. Thus, it is crucial that a European program provides adequate resources to biomedical research on MECFS that also considers the overlapping aspects of long COVID. This is what people with MECFS, clinicians, and researchers are claiming for. Thank you very much.
Muchas gracias, doctora Lacerda.
Thank you so much, Dr. Lacerda. It is true, research is absolutely key to reach what we are all seeking, which is improving patient situation. Continuing with this session of researchers, we also have the participation of Dr. José Vicente Lafuente Sánchez, Professor of Human Anatomy, IP, Principal Investigator of the LANS Neuropharm Group of the University of the Basque Country, Professor of Anatomy and Embryology, also as mentioned, Principal Investigator. I think I said it all right. I hope I didn't leave anything out. I leave now the floor to Dr. José Vicente Lafuente. 5 minutes, as you know. Thank you so much. Let's go and answer quickly. I was asked to talk about the current state of this disease, and as it is absolutely clear, because we're talking about it better than a few years ago, but many things need to be improved. Among them, in Spain, there are only 2 projects funded by CIS, Carlos III Hospital for this pathology, but a few years ago there was none. And in England, recently there was a survey, and it is one of the few countries where the data is done. It is seen that 85% of neurologists do not think it is a neurologist. This is NHS in the US opened a research because in the country there are not enough people researching the current state. What are our base? We need a common database for clinical shared data and biological data recorded in this, and with intoxication by cause or with AIDS, it could be a European program. We have to share, to homogenize the clinical characterization of these patients, adding all that it is done for sequencing, immunology, etc. These. And the third point, you say, it is respect to COVID-19, the long COVID. This is recent because the 2 cases, we have a reaction, anomalous reaction of the immune system, whereas an infection, other aggressions, the immune system or the nervous system, we only know them partially. They are very unknown. And we have realized that through these pandemics. there are figures, and now that I would like the politicians to look into, they do not focus the issue on generating knowledge. Long COVID, which is similar to my myalgic encephalomyelitis, it is a social problem, not only medical. After these pandemics, we have gone over 100 million infected. Only 10% or less had long COVID symptoms, 10 million. This long COVID has a fatigue of over 10 months, but in many cases it improves over time. And now, through our experience, many of the people who suffer this are going back to work and they are starting their life again. But there was some 10% which is not getting it back, and they are in a epidemiological situation which is similar to CFS, and it is 40 to 43-year-old women in their majority. When these patients will have been 5-10 years without a diagnosis, then maybe the story will be told in a different way. Now the figures are different, but it's only because it's only a few months later. But some extrapolation, 100 million, 10 million, then 10%, we're talking about 1 million more patients, and that is a social sanitary problems of great impact, because it is very young people who will require many much help from social help, and they are suffering. I would close encouraging to focus the problem, not only creating knowledge, which is something that I'm really interested in and motivated, but from the political point of view, we require a specific awareness plan to make a follow-up and giving support to these patients who will need for this, to reduce all the suffering of chronic fatigue syndromes. 1 minute left. It's a message that I talked about with patients. We've been talking for neurodegenerative disease. We talk a lot about curing, but when we are at such initial stage, the participation of patients and even if they have to repeat their story 10 times, they have to have blood drawn and find their biomarkers. We cannot find a solution soon. This is what we know. This is a present for the experience, a need for hope. It is a need to focus it from this point of view. I hope that in the future, a solution may be found. And I've stuck to my 5 minutes as I was told. Thank you. Yes, absolutely 5 minutes. As I heard, you even have the chronometer, the timer placed. So you have given us a very important point of view of what we have, what is facing us, and how these COVID pandemics, it is an opportunity somehow, so that a disease that until today will acquire somebody. It was much more stigmatized than it is now, and from now on may be less stigmatized for everybody's good. We'll pass on to the next step, which is opportunities. European Commission Research Opportunity Implementation of the EPs, Resolution 510, and this will be seeing the European Commission view, and as a representative, we have the presence of Catherine Berens, who is the deputy head of combating disease in the People Directorate of the European Commission's Director General for Research and Innovation, if I am not mistaken. I leave the floor to you.
Thank you very much for the kind introduction and for the invitation to participate to this event. And I'm very impressed by the commitment of all the people who have intervened before me. As you know, brain disorders impose a very high global burden. And over the past years, we have also seen an increase in mental disorders, which has further aggravated due to COVID-19. and its associated anxiety, isolation due to the pandemic itself, but also due to the various measures which have been taken to contain the virus. Overall, the EU has been strongly supporting brain research over the last years to address this major European and global societal challenge. And research supported in the area of brain research spans the full spectrum of research, from basic research, translational clinical research, to more public health oriented activities, in order to better understand brain health and disease, to develop personalized preventative approaches, diagnostics and therapies, and to support effective public health policies in the area. We are now reaching almost 5 billion euro invested in the area via Horizon 2020, and a big part of this funding is via collaborative grants, which allow cross-disciplinary approaches, bringing different types of expertise around the table, which is very much needed to address multifactorial complex brain disorders. And the EU has also over the years helped to structure the brain research area at European and global level via different partnerships, and together with various partners from public or private organizations. We do agree and align research agendas and prioritize research with a view to accelerating the delivery of concrete results and avoid waste of resources. So what is the status with myalgic encephalomyelitis, or chronic fatigue syndrome? Well, EU-funded research in that area has undeniably been scanned. But let me highlight a couple of projects that are directly relevant. First, the Help for Me project that focused on improving the quality of life by correcting gut microflora imbalances in ME/CFS patients. And it has developed a promising probiotic food supplement that is designed to counter the biological mechanisms responsible for irritable bowel syndrome alone or associated with other conditions such as myalgic encephalomyelitis. Another project, Discovery, studying the origin and causative mechanisms of IBS comorbidities like ME/CFS. We heard already the representative of the Euromene COST project, which is the integrated network of researchers and clinicians addressing gaps in ME/CFS knowledge, which is also supported via the EU. And we have also other projects, such as projects dedicated to pain or fatigue, which could also directly provide some insight into ME/CFS. I would also like to briefly mention our last call for expression of interest in the area of COVID-19, which is part of a massive effort of research and innovation in this area to better understand epidemiology and also to develop adequate medical countermeasures. The last call was dedicated to addressing COVID variants, and it focused on cohorts, clinical trials for vaccines and therapies, and the related infrastructures. And it included aspects related to long COVID and its sequelae. The evaluation of the proposals from this last call is currently ongoing. And depending on the selected proposals, this could also provide more insight when it comes to chronic fatigue and pain following COVID-19 infections. But despite these investments, we recognize the underrepresentation of ME/CFS in research projects, while there seems to be still a lack of scientific evidence hampering the development of diagnostics and therapeutic options. But this could also be the case for other medical conditions than ME/CFS, such as Lyme disease or back pain, for instance. So to address this issue, the European Commission intends to initiate a study this year under the new framework program for research and innovation, Horizon Europe. The study will notably delineate the categories of under-researched medical conditions that are of public health relevance, with a view to set out potential research priorities. And the study could also provide insight regarding how the ME/CFS research community could become more competitive when applying for EU funding in the future. And as there are still many challenges linked to ME/CFS that require attention, I think that the start of the new framework program for research and innovation, Horizon Europe, comes very timely. This new program will not represent a revolution compared with the previous program, Horizon 2020, but will build on past experiences, networks, etc. The aims of the new programs, which has a total budget of 95.5 billion euros, are to strengthen the EU scientific and technological basis, to boost the union competitiveness, and to deliver on the union's strategic priorities and support the development and implementation of union policies, such as the European Health Union called for by President von der Leyen in her speech for the State of the Union last September. Horizon Europe is intended to be much more impact-driven, as the program will notably aim at delivering on citizens' priorities while sustaining our socio-economic model and values. And there will be, again, plenty of opportunities for collaboration at European and global level. In order to make sure that the supported research and innovation projects can deliver on political priorities of the EC while providing concrete solutions to the society, the EC has co-created a strategic plan with member states and stakeholders via open consultations and meetings such as the Research and Innovation Days. And the strategic plan defines the strategic orientations for research and innovation investments over the 4 first years of Horizon Europe. Horizon Europe includes 3 pillars, which are underpinned by horizontal activities aimed at widening participation and strengthening the European research area. And we can expect health research to be supported in all the 3 pillars. The first one will support the creation and diffusion of high quality new knowledge and skills. Pillar 2 will strengthen the impact of research and innovation in developing, supporting, and implementing union policies and support the uptake of innovative solutions, both in industry and society, to address global challenges. And this is where most of the collaborative research will take place. And the third pillar will be about fostering all forms of innovations and facilitate the market deployment of innovative solutions. Within the second pillar, there is a dedicated cluster on health, which will focus on 6 destinations. And one of these destinations is about tackling diseases and reducing disease burden. Others will aim at helping our citizens to stay healthy, living and working in health promoting environments, having access to innovative, sustainable and high quality healthcare systems, unlocking the full potential of new tools, technologies, and digital solutions, and then maintaining an innovative, sustainable, and globally competitive health-related industry. So what can you expect in the work program? Well, they look a little bit different compared to the past, and they focus a lot more on impact. The topics mention expected outcomes from the supported research and indicate the target groups that should make use of the outputs of the projects to maximize impact. The work program for years 21 and 22 have just been published about 10 days ago, and they are available on our funding and tenders portal. So I would like to encourage you to browse through these in order to identify relevant topics. And all relevant information regarding the work program and the way to apply, etc. Everything is available on the funding and tender portal. And I would also like to underline that we will be holding very soon, actually this Friday, a virtual information day for our health cluster, where questions on specific topics can be asked. So I see a lot of opportunities coming your way, and I hope you will grasp these. And in parallel, we will be initiating this study in order to better understand which areas are really under research and would need a little bit more of attention, and how we can do that in the future. Thank you very much for your attention.
Muchas gracias por su intervención.
Thank you for this intervention. I gave you some additional time because I thought that this was a very important topic for all of us, both patients and researchers. It's important for us to come to terms with the economical situation of this program and what the possibilities that the EU offers are. I will not go into much more detail, but thank you very much for your intervention, Dr. Behrens. We'll start the final block of our event, which is the European Parliament block and their perspectives. In this block, we will hear from Maltese MEP Alex Agius-Saliba, who is a member of the S&D European Parliament group, and he will represent the Labour Party of Malta. Within the European Parliament, he's also a member of several committees. He's a member of the Interior Market Committee, the Petitions Committee, the delegation for the Caribbean and the Pacific. He is a member of the Mediterranean delegation, and he is a deputy member of the Employment and Social Affairs and Artificial Intelligence Committees. He's also a deputy member at the delegation for relationships with Palestine. So without further ado, Mr. Agius-Saliba, you have the floor.
At the moment, I can see it in the room.
¿Está en la sala?
No, no creo.
No.
No, I don't think he's in the room.
Si no lo tenemos,
Okay.
porque no haya podido a lo mejor
If
conectarse.
he's not here, perhaps he had some technical issues to get online. In that case, if that's okay with you,
o bien Jordi Cañas, que también es
we could hear from Mr. Cañas, who's also an MEP. Mr. Cañas, would you like to say something else? I think you did a very good job with your introduction and the perspective of the European Parliament and what politicians can do to support us. It was all very clear in your introduction. But the key here is working together, as we have heard from other panelists.
Bueno, mira, ya le tenemos por aquí.
Oh, here is our panelist. I can see him now.
De tiempo ha podido conectarse.
I'm happy that you could join us.
Bueno, pues ¿nos escucha ya?
Can you hear us, Mr. Saliba?
Alex?
Hello,
Alex,
yes.
can you hear us?
Sí, le he hecho ya la presentación de
You've already
que
been
nos va a trasladar la
introduced,
visión desde el Parlamento
and I have explained
Europeo
that you will share the European Parliament's perspective when it comes to the petition that we presented. You were the Shadow Rapporteur
la resolución aprobada en 2020.
of this resolution that was adopted in 2020.
Tiene la palabra.
So you have the floor.
So first of all, thanks again. Sorry I didn't get all your introduction, but my interpretation was not working from the beginning. First of all, I would like to start by thanking my colleague Jordi Cañas for, first of all, organizing this important and very timely event, I must say, which aims to highlight the first anniversary of the resolution calling on additional funding to biomedical research on ME, which was unanimously adopted by the European Parliament in the January 2020 plenary. Living with ME or chronic fatigue syndrome can be very difficult and sometimes also impossible. Extreme tiredness and other physical symptoms can carry out everyday activities, make it very difficult, and can also affect the mental health of these patients. Unfortunately, due to the very large gaps in research knowledge, ME and CFS are still relatively poorly understood by many doctors, and that is why many patients are incorrectly diagnosed and also poorly treated for their ailment. Consequently, some patients suffer from symptoms for many years and are still being poorly diagnosed for this. At the Committee of Petitions, we received a number of petitions raising a number of concerns over the absence, first of all, of treatment, and also the current underfunding of biomedical research on chronic fatigue syndrome within the whole of the European Union. During the hearing that we had in the Committee of Petitions presented by the petitioners themselves, some of them also facing ME challenges, we have decided to follow up on these very important petitions. First of all, by having a motion for a resolution calling on the Commission to dedicate added EU funding for research into ME and CFS and for projects focused directly on biomedical research to be prioritized. The EP resolution also stressed that researchers must first of all cooperate more to help in diagnosis, test, and also when it comes to treatment, and also to increased knowledge, to increased awareness among our health professionals throughout the union and also throughout our public. Better recognition and also better understanding of the diseases of paramount importance to improve the quality of life of our patients. Furthermore, a lack of treatment and also a lack of funding for research into the disease, which affects around 2 million people in the EU, was also highlighted in several written questions that were addressed to the European Commission. A year ago, I have also tabled a written question to the Commission where I have stressed on the need of additional funding and also prioritization of calls for proposals focusing on biomedical research into ME and CFS, with the aim to develop and also to validate a biomedical diagnosis test and also effective biomedical treatments, both to cure and also to alleviate the effects of the same disease. I have also asked about possible EU actions with regard to cooperation between different member states and also of exchanging the best practices between member states, both when it comes to screening methods, when it comes to diagnosis, when it comes to treatment, but last but not least, the need of creating the EU prevalence register of patients affected by ME and CFS. I am glad that in response to the EP resolution, the Commission, first of all, has acknowledged that research into new treatments and diagnosis is clearly a priority, and it's really important. Moreover, ME and CFS are posing a heavy burden on both the patients and also their families, and also recognizes that the lack of specific diagnosis tools and also treatments in tackling the serious condition. In this respect, research on ME and CFS and also other related diseases has received its support through Horizon 2020 research program, which will give, first of all, a better possibility of understanding of the disease and also its drivers, including pain, causative links between health determinants and also the same disease. However, Horizon Europe does not focus on specific diseases, but rather on categories of diseases. Therefore, there is need to implement policies that will allow scientific research on a broader scale of categories of under-researched diseases like ME and CFS. Another financial instrument, namely the EU for Health program, will give more opportunities to scientists and also other actors with specific interest in both ME and CFS to support their research and also goals in improving the conditions of patients throughout Europe. One of the main objectives of the EU for Health program is to strengthen our health systems, including through increased integrated and also increased coordination work amongst member states and also the sustained implementation of our best practices. Priorities for the latter are set also via the steering group on health promotion and disease prevention and also management of non-communicable diseases. Nevertheless, the steering group has still not identified ME and CFS as priority areas for this purpose. To conclude, I would like to stress that if we ultimately want to achieve better results, more concrete results, we need to work together with different European and also national stakeholders, policymakers, and definitely directly with patients themselves. First of all, together we need to promote cooperation and exchange the best practices between member states as regards, as I said, screening methods, diagnosis, and treatments. We need to provide better funding to ensure appropriate and also improved medical education and also training of our health professionals. We need also to promote feasibility of a new fund for the prevention and treatment of ME. Thank you.
Muchas gracias, perdón, es que vamos súper justitos de
Thank you very
tiempo.
much. I'm very sorry to interrupt you, but we are short on time.
Muy interesante todo lo
This
que nos
was
ha
very
trasladado,
interesting. Thank you for your statement.
siendo todo en línea de lo que
It's all
todos
aligned
venimos diciendo,
with
porque casi todos estamos
what
coincidiendo
the
en
other
esa
panelists have said. We all agree that we should work together and
Bueno,
cooperate.
finalizado esta intervención desde el
Now that
punto
we
de
have
vista del
heard
Parlamento Europeo, pues
from the European Parliament,
las
we
4 puntos de
have
vista
finished the 4 main blocks, and we have heard the 4 main perspectives of patients
sería el
and
turno de
politicians.
preguntas. El turno de preguntas serían 20 minutos, como les dijimos al comienzo.
Now we'll have the Q&A session, as I said at the start.
Del evento.
It will
Las
last 20 minutes. As I said, you need to send your
del chat,
questions on the chat.
pero así un poco por encima y salvo que
I've had a quick look
me
at
apoye
them,
un poquito, la verdad es que hemos ido recogiendo muchos
and
comentarios
we have
pues
collected
favor de todo lo
many
que
questions and comments in support of what has been said so far.
preguntas así muy
But I
concretas
cannot see many specific
no
questions
tenemos
for specific panelists. We don't have many of them. We
vamos
have
a
a few
dar
questions,
paso a ellas.
and we will get
Em,
started with them.
Las preguntas que se han realizado en inglés se va a encargar nuestra técnico de
We
Confes
have received some questions in English,
de hacer estas
and they will be asked by our technician.
y a mí, por ejemplo, sí que hay a título personal y desde el punto de vista de tanto desde Confes como entidad representativa
Personally, and
de un
on
país
behalf
concreto,
of
sí que me gustaría
Confesc and my country, I would like to pose a question.
pues tanto a los europarlamentarios.
My question is for our MEP
Europea
guests.
en la cual que se aprobó en 2020
The
sí
European
que es verdad
resolution was adopted in 2020, and it included the need of raising awareness and training specialists.
condiciona a que
To what
se
extent does this condition the implementation of this policy in all member states?
efectivamente unos planes
Does it contribute to the development of training and awareness raising programs? We have been calling for them in all our countries, associations have been calling for them, but to date, this still remains to be done, at least in Spain.
Entonces, no lo sé si
So I wonder whether Jordi or Alex have
de
any
Malta
answers to my question.
darnos una respuesta a esta de qué manera esta resolución puede
Could you please
condicionar a
tell
que se
us
implanten en
how
los Estados
the
miembros.
resolution that you adopted can lead to the implementation of these policies in member states? I can give you a brief and clear answer. It's not binding. Member states are not forced to do anything, but they should take heed. This is a very complex issue, a research and political issue, and we need to keep going. This resolution paves the way for our objectives. The resolution tells the Commission what the Commission should be doing, but the Commission is under no obligation to do that. I always like to be very clear so we all know where we stand. The European Parliament has sent a petition to the European Commission. We want research programs to include funding for EM research. However, this requires an integral approach, a cross-cutting approach with programs, strategic lines, and what we want is to have national parliaments force national governments to take
nivel
action.
legislativo, a nivel de protocolos de detección, a nivel de concienciación, como bien decía el compañero del Parlamento, de los equipos sanitarios, es ir avanzando. La resolución lo que marca
It
es un
is
camino.
going forward. The resolution is the way we have to go, and the different political groups, what they have to do in turn is to promote the national policies to go that way, because at the end of the day, I think it is one of the elements that we've heard throughout the day on the comments, that we have to work together. We have to join together in our efforts. So the resolution establishes one direction. It indicates that what we European members of parliament want, that is working together to reach those goals. For instance, in Spain, over the last few years, there have been different non-law proposals from different political groups and from different patient associations, but the reality is that all this does not materialize, not in non-legal proposal, but into a law that we're really, because it's all proposals, but they go on from one proposal to another, and they are still something to be done or in progress, but then it never materializes, it never boils down to anything. So is there a possibility that really this will be a framework, a law, a real law, a legal framework to recognize this pathology, because it's a serious pathology, we all agree on that. And it is ever, science is proving ever more that there are some biomarkers that are coming up, and it is a real disease. It's neither psychosomatic nor anything like that. Nor do we women have women issues, because in Spain and in other countries, there is a great gender bias of all types, starting from the health public system. Well, but I don't want to be too harsh about this, because it is a process. It would take time, and I'm really grateful that the follow-up that we are seeing on a political level from Jordi Cañas' office and the resolution of the parliament we'd never had before until today. We never had anything similar, because it has not been just a resolution that was there, but a follow-up was done, and the commission received consultations to see which way something could be materialized and not living it there just as words. Just one thought, Maria, if you allow me, and that is based on what the resolution means 1 year later. The Horizon program, the Europe Horizon, is different now. We have resources for research, and what we must do, and we must prove, because the laws often, we're always waiting for the laws, what we have to do is research, and research requires resources, cooperation, and coordination. Joining efforts together, articulating research networks of Europe, and as different panelists have said, you need common databases, a common European patient database or register. We need to take advantage of what we have, that is research distant to medical research, to offer research programs that can put together the different initiatives or research lines in the different European countries, because we're talking about Europe. Putting together our efforts and our resources to take advantage of the research work we can do. There is collaboration and cooperation amongst them. And the goal of this event, of this meeting, and the follow-up for the future, that generates spaces for meeting so that we know that if we want to get research funds, we have to be able to propose common projects, which from wide perspectives of multidisciplinary, pan-European points of view, join efforts together to go ahead with research. Of course, following the common protocols, harmonization of protocols, all that is true. But what is important is that we've sent the message to the Commission. They have created new European funds, which develop the previous ones, but we have more resources now. What we have to do now, we must be able to go get them. Yes, that is key, and I think it is really important what Dr. Catherine Bragg has said before in representing the European Commission. The training day that is going to take place this coming Friday, something to be really enhanced. And I would thank Professor Catherine, and in the chat I would like her a note in which way can people join, all those people who are interested, how can they join, and who would these training days be directed to, only to researchers, or even, it is true that there are some research projects which were promoted by patient associations or together with other associations or entities. And so if Dr. Catherine Behrens could do us this favor so that we can disseminate this as much as possible. As Jordi Cañas says, it is key that we must be able to make use of those resources and making them become research. And another important thing was how complex the complexity of the presentation or the bureaucracy in all these projects. I think that the information days are key to clarify all this bureaucratic process, which is one of those things that is more complicated, and above all to see to what extent we can support everyone so that these resources can be made the best of, and that the relationship with COVID-19 has been key for these pathologies to be taken into account a little more, because as it was said by the Dutch patient, anyone can suffer an infection and develop a myalgic encephalomyelitis. There were a few more questions. Well, if you leave the floor, there are 3 researchers who've raised their hand. Please leave the floor to them. Yes, I leave the floor. As the 3 researchers are there, let's see in what order they would like to come in. Maybe in the first place, Dr. Eliana Lacerda, in order of participation in the event. I leave the floor to Dr. Lacerda.
Thank you very much. I just want to raise a few questions. For example, when Catherine Behrens talked about the new potential accommodation of research, I just want to tell that it's true that the European Commission supported the Euromin, but the Euromin was not research. The Euromin was a project for networking activities. And just to give you an idea, we were very helpful to look at this project, and we managed to identify specific issues that the community of patients have been talking about. And we identified them, we published them, but we started doing research in collaboration in this area before the Horizon. We have been submitted applications to the FP7 and even to the Horizon with involving many groups of researchers across Europe. And I think that we are talking here about priorities of 2 million people who have this disease. And I think that these have to be considered. We all know about how the European Commission go on funding, but we need substantial funding to do that. And to give you an idea, we have a fraction of 1 year in my particular group that we have from the funded from the NIH. So this funding for 1 year, it was the fund that we received for networking for 4 years involving 21 European countries. So I think that these disparities have to be said. And we are talking about a real disease that needs substantial funding for biomarkers, for data, and for clinical activities, including training clinical personnel. I think that this is the most thing that we have to be aware. And you as European MPs, I think that you have to take the burden to bring this to your colleagues and to raise awareness, because without this, there will be no progression. And I think that because of the situation of COVID-19 and the potential biomedical activities on that, this could create opportunities and create opportunities out of the box, out of the very specific, rigid ways. And we heard so much that you have to be competitive, and we are. We are competitive, and we have resources in terms of intellectual capacity to run very good research. So this is what I would like to say to the MPs. And I'm very happy that they are here to take this message forward. Thank you.
Muchas gracias, doctora Lacerda. Vamos a dar paso a...
Thank you so much, Dr. Lacerda. There's a question in English now. We'll leave the floor to the next researcher, Dr. Fuente. Andrea, please.
So, Helene from Denmark, right? She asked to the MEPs, to both Jordi Cañas and our MEP from Malta. What can the politicians in the EU can do to minimize the conflict between being the disease, myalgic encephalomyelitis, as a physical disease, or on the other hand, being the disease as belonging under psychiatric departments and personnel? She said that this can be a conflict or in delay of the treatment and so on. And she has another question that says, how can the EU deal with the different views that exist within new member countries in regards to the physical psychological dilemma view on ME? Thank you.
If I may on this question, I think that first of all, ME CFS is definitely not a disease, a mental disease. So I think this should be the starting point of all discussions. On the other hand, I am totally also concurring with the point of view that Jordi Cañas has also stated some minutes ago, when he said that basically the resolution that we moved forward, which emanated also from a petition in the Committee of Petitions, is a strong political message, but then I think we have to be reasonable when it comes to legislating directly on specific health matters. I think this is the furthest that we could have gone at European Parliament level, because obviously we have to be realistic because of the competences of each and every member state. But still, I think that the declaration was very clear. It was still a very strong, the motion for resolution was a very strong political message, which gave, first of all, visibility. And for the first time, we heard the European Commission speaking directly on ME and CFS, but still we haven't achieved precisely what we have been asking for. First of all, because although now we have more resources when it comes to Horizon Europe, still there are complications when it comes to implementing specific scientific research on specific categories, a specific disease, because Horizon 2020 still deals with broader categories. So we have to still fight at political level against this stumbling block that we still have. And it's still a shame for me that when it comes to the steering group on health, promotion, disease prevention, and also management of non-curable diseases, the group has still not identified ME and CFS as a priority for this purpose. And there, I think, is the political push that we have to continue to give at European Parliament level for more recognition when it comes to ME and CFS. I think that the question of ME, CFS being a mental disease or not is a question which is still, unfortunately, a reality in a number of member states, but I don't think that it should be, and it is the role of the European Parliament to say so, because the scientific research is clear enough and pointing in a obvious direction that no, definitely, this is not a mental disease, and this is not something which is being made up by patients. So I think this is a very clear answer to this question.
Una de las preguntas que nos
One of the questions, we are going to close the questions. What can be the role of patients associations in the in the research? Lisa is asking from a children's association who suffer from this pathology. And this question
a alguno de los europarlamentarios como
can be for a Europarliamentary, for a member of parliament, or Dr. Catherine Brands, who is the representative of the Commission, of the follow-up of the funds and the research.
No creo que se haya enterado.
I don't think, I think you should answer this. You should answer, because we are not going to answer better than you. It is your turn. No, but it is true that, for instance, in Spain, the Carlos III Institute, which is the #1 institution for research, and it coordinates many research projects on a European level. From here, we see ever more the need that patient associations must be integrated within the research projects by researchers. So it is key that this relationship between a research project and patient association be there, because, and why? Because they have to obtain data, unfortunately, through the suffering of patients, because often It is not so easy for us, but is there any way that will be implemented within the next Europe Horizon project to strengthen this role, or that makes that be mandatory for researchers to talk to patients?
No, pero Alice Prazkia está levantando la mano.
Alice is raising her hand. I'm not sure, maybe Catherine Bren wanted to speak, but otherwise I leave the floor to Alice. We have very little time left. We have to close. Maria Jose wanted to speak. I wanted to say something to Dr. Beren.
Es el doctor José Vicente Lafuente. Pues sí, aprovechando, coméntelo y ya que nos responda las dos cosas.
Como sabéis que yo soy sumamente breve, voy a sugerir una imagen de nuestra infancia. Dame un apoyo y moveré el mundo.
You'll probably remember that phrase, give me a support point and I'll move the world. That's my message to Dr. Behrens and Jordi and Alex. Give us a topic in the 2020 horizon and we'll be there, we'll show up. The problem is that the call for applicants does not include any topic where we could be included. And you know that this is important. We need a specific topic that we can apply for. We have suggestions for topics. We can share them with you. We don't think that EM requires a specific topic because that's impossible because of the current political perspectives of the European Commission when it comes to Horizon programs. But we could have a more general topic such as inflammation, non-resolved inflammation, or other titles. Okay, Dr. Behrens, you have the floor. And then we'll move on to the conclusion of our event, which will be done by Maria Lopez and Jordi Cañas.
Thank you very much. Well, to answer to this question regarding the fact that there is no specific topic for you to apply, I would tend to disagree. There are many opportunities for you to apply, and I would not screen our work program just by the name of the disease. Because that would be really restrictive. Now we really focus on impact and on outcomes of what we want to fund as research. So there are many opportunities for you to apply. You mentioned inflammation. Yes, have a look in the work program. You will find that. You will find many different possibilities, many entry doors. It is up to you to fine-tune your research in order to fit in the topic. And you will see that many of the topics are really geared to provide direct impact for the patients, because we really think that this is important, that the research that we fund makes ultimately the difference for citizens and for patients. And I would like also to link to the previous comment, include the patients. And I think there is also many opportunities for doing exactly that. So the consortia are not only about researchers or clinicians, but you can also include other types of beneficiaries, including patients or other types of stakeholders. So grasp the opportunities where they are. And I think you will have many more opportunities with us not mentioning specific diseases, because then it allows you to study together with other research groups the shared pathophysiology of different diseases. If we go for one single disease, then you will be restricted in the type of research that you would like to put forward. So it's also opening and broadening the type of research at the boundaries of different disciplines, I would say. So I would really encourage you to screen the work programs, because I'm convinced that there are many opportunities out there. And I'm very pleased that there is already a network which is already exchanging their ideas, and you should build around that one and come forward with your projects, which should get through if they are really answering the needs that we put forward in the topic. So I hope that this reassures you that there is something for you in Horizon Europe. And I really look forward to seeing you applying to our core topics.
Bueno, por concluir, pues me estaba dando cuenta de que las preguntas, en lugar de hacerlas a través del chat, las han hecho dentro
I realized that questions were sent by the Q&A tool rather than the chat. So while we conclude, I invite panelists to have a look at the Q&A section on Zoom, because there are questions that have been specifically sent to specific speakers, for example, for Dr. Behrens and for other panelists. We will collect all these questions in any case, and we will try to send them to the people that they were addressed to, so they can answer them later on. So, as I said, we are running a little late, so I will give the floor to our concluding speaker. I think this event has been very inclusive, and we have heard from participants from all stakeholders. So, Jordi, you have the floor, and you can make your concluding remarks about this event. Maria, I will not share any conclusions, but some thoughts. The aim of this event was to be useful and also to connect the administration, MEPs, commission, researchers, and patients. It's important to create areas for debate and fora for our meeting. This is not a conclusion, this is a beginning. We have data from all participants, and I think there are some important and key messages. I want to recall what we heard from Dr. Behrens at the end. And I also have a message for her, for Dr. Behrens. The European Commission must help and support research teams. Why? Bureaucracy obviously is necessary, and we should not blame bureaucracy. However, researchers need to adapt to the requests placed and the requirements placed by the Commission, and you need to learn how to do this. Researchers need information to do this. Some researchers have teams that are better able to address bureaucracy, but we still need to approach them. We want the Horizon funds to be useful. That's what the Commission wants. But we need to make sure that these funds are getting to the hands of researchers. We need to spread the word about them. Sure, there's a portal, but we need to be more proactive. The Commission and the other European institutions are a glimmer of hope because of their capabilities and resources. But we still need to improve our communication. We need to be more approachable for citizens, and in this case, for researchers. Therefore, I call on the Commission to lead and support researchers. We heard from 2 researchers here who said that it was difficult to reach these funds. Well, we now know them. We need to support them. So, my conclusions. It's important to stay connected. We need to cooperate and collaborate. When the European Parliament unanimously adopted this resolution, we realized that politics is not just about confrontation, but also about cooperation. At the European Parliament, we cooperate, and we will keep supporting and accompanying this process. We are moving from being invisible to being visible, but still, we need to raise more awareness, create more knowledge, and we have a key tool, research and funding. In the COVID context, especially the long COVID context, many medical professionals will realize that this is not a mental problem. It's a condition. And this condition has an origin that we can find, that we can work out with biomarkers, for which we can find treatments. And one day, probably not tomorrow, but one day we will find a cure. This is what gives us hope. And this creates an obligation for us. We need to reinforce our shared spaces. We need to listen to each other, cooperate, and come together to reach our shared objectives. Our objectives are political. We have resources. And the shared aim is to be by patients' side so that patients know that politicians, researchers, and the whole society are by their side as well, that will no longer be stigmatized and made invisible. We will be with them, we will work with them to find a solution. Thank you very much, Jordi. Finally, I'll give the floor to our Vice President for the final remarks of this event from the patient's perspective. However, before giving her the floor, I will say my goodbyes, and I want to thank everyone for coordinating this event. I want to thank Jordi Cañas' office, especially Maria Alemani. Maria has been working with us very closely. She was another member of our team, and she made this possible. You brought us all together to create this event, which is so important and so relevant. The final conclusion is that we should all work together. Also, I want to thank Maria Lopez, our Vice President. I want to thank the three technicians we have working with us at Confesc and the International Working Group. They have been working together with Maria Alemani and Jordi Cañas' office in order to make this happen. Everything that was said today will be very productive, I hope. So, Maria, you have the floor. I don't want to take any more of your time, but thank you all for coming. Thank you all for joining our event. I hope you enjoyed it, and hopefully it will be the start of our future cooperation. We need to keep working together. The 4 blocks, the 4 sectors that we heard from, we need to work together to make these projects happen. So, Maria, you have the floor. I don't really have anything else to add, Maria Jose, because you said everything. But thank you very much for giving me the floor. Thank you, everyone. I think it's very hard to present any conclusions. It's all about the needs of patients, but also the needs detected by researchers and clinicians. We need funding. We need to reach our colleagues. We need to communicate. We need to research and help patients because patients are suffering. I want to share some of the remarks that were shared in the chat. There is daily suffering. There are problems related to work, to money, to social issues, to healthcare. Healthcare is barely existent in most European countries. We have seen that ourselves. It all depends, it all comes down to the means of each patient. Therefore, there is no equal access and accessible access to healthcare. No clear solutions have been offered. But just being stuck at home and abandoned is not a solution either. So we are calling for a further push. Evelyn started this. We all signed the petition that was presented last year. We call for specific help for our patients. And this still stands true. I think that this must be clear today. This is what we all try to communicate today. We need research. We need to ask researchers to look for that space that Dr. Behrens spoke about. Please come together, come to an agreement, bring all researchers together, even researchers of other conditions, so that you can get those funds. Hopefully, patients and patient associations will find a way to help you. We will look for the means and resources. And we will look for funding at a European level, but also at national levels. There are issues that need solving at an internal level, and we need to get other politicians to join us. Politicians from national governments, regional governments.
Bueno, yo creo que ese es el tema. Vamos a ver cómo
I
entre
think
todos
that is the main aspect. Let's try to make the most of those resources that apparently are within hand's reach. And let's see whether we can leave aside the things that divide us. Let's keep moving forward with the things we share and that we know about. The need to push forward with research, biomarkers, treatments.
Y es un principio, como decía María José, y como decía también Jordi, tenemos que seguir
as we heard from María José and Jordi, this is just a start. This is the way to go, and I am sure we'll keep doing it. We have received many questions, we have collected them, and we will try to answer them. We will use them as food for thought. We will send them to our panelists so we can think about them together. Thank you all. Thank you very much. We have gone over time. I hope Maria Alemani will not be very angry. I'm sorry, Mr. Cañas, but thank you all very much.